To share with you today. This is a Q&A with Dr. Megan, the prednisone pharmacist. And so I'd love if you comment below what your questions are. I'm definitely going to be covering pain with prednisone withdrawal or pain while tapering off prednisone, just pain in general. People seem to be really struggling with that. I've been getting a lot of questions about that. So I just really wanted to cover that more in depth today. And other than that, please comment below what your questions are. If you're watching this after the live broadcast, then definitely post your comments below, your questions below the live stream, and then I can answer those later. So, in a future live stream or as a long form video. So, here are some questions I have recently gotten. I'm just going to read this story of this personal experience somebody's having because it seems to be kind of the same story a lot of people are having. So if this is you, like raise your hand. So this is what she said. She said, "Hi, Dr. Megan. Thank you so much for your personal perspective and clear information on how to navigate prednisone. I've been on and off the drug since February of this year due to extreme bilateral carpal tunnel pain. Fill in the blank, like due to extreme fill in the blank, right? Like for lots of other people's diagnosis. Initially, it was thought that I had a pinched nerve because I had neck pain as well. Good news, neck and wrist are unrelated. Bad news, over the counter NSAIDs like ibuprofen and Naproxen were not doing the trick when the wrist would escalate to the point I couldn't sleep at night. Giving you the backstory because I am not your typical prednisone patient. I followed a lot of your great advice on how to navigate prednisone. But boy, oh boy, I did not understand how prednisone withdrawal can be really difficult. Amen. I woke up with pain in my neck, shoulder, elbows, knees, ankles. Um, and when I didn't manage my taper like I should have. So if she didn't do her taper right, she woke up with tons of pain. I was in so much pain. I started looking for a rheumatologist because I feared I had rheumatoid arthritis rather than just carpal tunnel and neck issues. Which brings me to my question for you. I would like to decrease and taper off prednisone 100%, but I don't know how to manage the joint and muscle pain. That is pretty severe for me. I've been doing a lot of reading. I wonder if you have any experience or opinion on low dose naltrexone for pain management as you come off prednisone. I've read a lot of studies and looked at the opinion of pain doctors, and it seems like LDN, which is the acronym for low dose naltrexone, would be a good bridge to deal with pain that comes from prednisone withdrawal, and it helps rather than impairs the immune system. I really value your opinion and feel like there is not information out there to effectively deal with the pain that comes after you stop using prednisone. It feels like the prevailing opinion is it could take months or years for your body to get back to normal. But how do you deal with the pain? Eat Advil like they're Tic Tacs? Go to the opioids to deal with the pain? Go for high level NSAIDs like Celebrex, which have their own issues? Would love to hear from you, or have you used this question as a post to discuss how to manage pain post prednisone? Thank you again. Keep up the good work. Fantastic question. Pain post prednisone is real and it is something that people commonly experience. It's also known as prednisone withdrawal pain or glucocorticoid withdrawal pain or corticosteroid withdrawal pain. And it's really a tough situation. Um, I frankly was surprised when I started hearing about this from people who took prednisone. I didn't personally experience this side effect myself. And as a person who went to pharmacy school, got my doctor of pharmacy degree, became board certified, and then became a prednisone patient, in none of those times did I ever hear of pain post prednisone. I never heard of prednisone withdrawal in any of those times. It was a complete shock to me when I became the prednisone pharmacist and thought, hey, I can help people with prednisone side effects. And I'd never heard of withdrawal in any of those times. Like, it's not something that they teach about in pharmacy school. as far as I can tell, it's not something that's commonly taught in medical school. It might be in certain medical schools, but as far as I can tell, this is not a topic of discussion that people bring up, like pain and prednisone. I'm not. It's not a super common topic of discussion in school. So, uh, raise your hand if you're experiencing this. Comment below. Hey, I've been having this pain issue. If you are here live with me, comment below what other questions you might have about prednisone. I'm going to keep going deep into this pain post prednisone and withdrawal pain. But if you have other questions, please comment below what those are. So I actually have uh, an article, a scientific article that a doctor posted. Um, Let me see if I can find it really quick. Okay. Um, let's try another way of searching for it. But it was basically a scientific article published between two different academics. Ooh, let me see if this is the article. Okay. And I'll share my screen if this is the right one. All right. Okay, I'll stop. I'll share this if I can figure out how to share it. Share. Here we go. Share. Okay, so this is the Journal of Pain and Symptom Management. Doesn't that sound like the perfect journal to be answering a question for us? And it talks about in the introduction is like it's frequently prescribed, but steroid withdrawal may be frequently underdiagnosed and untreated because if doctors haven't heard of it at medical school, and then they're not going to know to treat it, and then it's causing significant pain for people. And the symptoms are broad. I love how it talks about how this is just a broad array of symptoms and they're not well recognized. And fever is one of them. It's so weird because normally, if you have a fever, that means one thing, right? You're sick, you have an infection. But when it comes to prednisone, it's like, actually, is it? Like, is the fever an illness or is it withdrawal? And so here's the definition of withdrawal syndrome: an objective syndrome resembling true weakness. Excuse me. Objective syndrome resembling true adrenal insufficiency and characterized by fever, anorexia, nausea, lethargy, malaise, arthralgias, desquamation of the sin, weakness, and weight loss occurring with highly variable grading in patients undergoing steroid withdrawal, also in the presence of biochemical evidence of hypothalamus pituitary adrenal system integrity. Would you like me to translate that into English? So basically, it's saying your adrenal system is working, but you're going through misery, fever, you don't want to eat, you feel exhausted and yucky, you have joint pain, your skin might go weird, you might be weak, you might be losing weight, and it's awful. And I don't see actually joint pain, I don't see muscle pain listed, but that's often also a definition is muscle pain. Oh, here we go. Other symptoms: abdominal pain, vomiting, low blood pressure, postural hypotension, hyponatremia, and hyperkalemia. So, all of these awful symptoms people experience. And here we go: fatigability, myalgia, arthralgia. So, those big words means you get tired easily, you have muscle pain, joint pain, and emotional instability. So, these happen. It's real. You're not imagining it. It's not some new disease, although it could be, and definitely talk to your doctor about it. And they just talk about other like cases. But what I really want to get to is here the treatment of steroid withdrawal syndrome. Um, so they're like, if they're having a fever, you should make sure they're not actually sick. But if a person is not actually sick, having these miserable feelings, reinstitution of oral steroids. Like, this is the worst news I can share with people. Like, nobody wants me to tell them, hey, just, like, you've worked so hard over how many months to taper down slowly over prednisone. Like, say you started out at 20 and then you went to 17 and a half, then 15, then 12 and a half, and then 10. And then you went down by 1 milligram a month, 9, 8, 7, 6, 5, 4, 3. And now you're having withdrawal pain. I'm telling you to go back up in dose. Like, what? Like, that is the worst news. Like, I remember when I was taking prednisone, how awful it was when my doctor's like, actually, your autoimmune disease is flaring. We've got to go back up in dose. And I'm like, no, I'm not going back up to 60 milligrams. Like, not again. I don't want to do that again. I'm sick of gaining weight. I'm sick of moon face. I'm sick of insomnia. I'm sick of all of it. I don't want to do it again. And like, if you're having this, it means go back. Like, no. Like, current literature supports reinstitution of steroids as the mainstay of treatment in steroid withdrawal syndrome. That is like the worst. So, like, another guy asked me, "Hey, are there any supplements I can take?" So I'm gonna pull up his question really quick. So stop sharing that. Stop screen sharing. And I'm gonna find his question because it's like, okay, here are his questions. Pull them up. And here's what he says. Okay. He said, "Are there any supplements you would recommend that encourage the adrenals to wake up and recover better and faster?" Because he's experiencing all those symptoms too. Like, he has talked in depth with me, scheduled an appointment. And he's like, "What can we do?" And basically, he's wondering, are there any supplements that would encourage the adrenals to wake up? I can't say that there are any safe supplements to encourage the adrenals to wake up. Like, there are adrenal supplements, adrenal support supplements, cortisol manager supplements, none of which I would recommend while you're taking prednisone because they're designed for people who are not currently taking prednisone to help their body start making cortisol more or better. And they're like, they are going to interfere with the prednisone if you take them. It's a drug interaction. Don't mess with them. Like, those are not safe. So here's a question just came in. I'm going to share this. Emailer says, is there any amount of time if you could tough it out that the withdrawal pain will go away and you could get off the prednisone? So I'm not aware of any scientific articles studying this. The only stuff I find is saying, if you're having this, you go back. I've never talked to anyone who's like, yeah, I toughed it out and I'm fine. Like, it's not, as far as I can tell, toughing it out doesn't work. Maybe it does, but I have no evidence to support saying, hey, just tough it out. It'll go away eventually. Like, you might be stuck in bed for a month and agonizing pain, not able to feed yourself or dress yourself because it hurts so much to move, but it'll go away after a month. I can't say that. Like, that's not true. There's no evidence to say toughing it out will work. As far as I'm aware, with the evidence available to me at this moment, the only thing you can do is, if you are going through prednisone withdrawal, is to go back up on the dose that didn't cause prednisone withdrawal. So if you were going from 10 down to 7.5 and you're like, it's awful, go back up to 10. Stay there longer. And instead of dropping from 10 to 7.5, like, that's 25% drop. We want to focus on percent drops and not milligram drops. Dropping from 20 to 17.5, that's only 2.5 milligrams. 10 to 7.5 is 2.5 milligrams. But the percentage drop from 20 to 17.5 is like somewhere much less than 25%, right? It's like 12.5% or something, right? Something, I can't do the math while I'm live, but it's a small percentage compared to a 25% drop. We want to keep it 20 to 10%. like a smaller percentage drop. So instead of jumping from 10 to 7.5, go 10 to 9. Get access, have your doctor prescribe 1 milligram pills of prednisone. Like, do that instead. And by the way, I've got to give this disclaimer. What I am saying here is general information. It is not medical advice. Talk to your doctor about that. Your doctor is your expert on your medical care. Okay. There's your disclaimer. Make sure your doctor is your medical expert for you. So I don't know of any amount of time. It's not like, oh, if I tough it out for a day, a week, a month, a year, I don't know of any of those that it's like, ooh, that's perfect. And so emailer says, okay, thanks. I kind of figured that was the case. Yeah, that's the case. There's no evidence showing this is going to work, unfortunately. I wish we had better information about this, but at this time, there's no answer to that question. So back to the other prednisone warriors question. He said, so are there any supplements I would recommend? No, there are no supplements to wake up adrenals. For that specific purpose, I don't know of any. He said, in addition to as to which supplements help adrenals wake up, he's on low funds, so he can't buy pre-made supplement combinations. So what he's referring to there is Nutrinizone. This is the pre-made supplement combination I invented to help people on prednisone to give you all the nutrients you need to support you while you're taking prednisone. And people have told me that it helps them to taper. So this is exactly what you need, but it's not going to wake up the adrenals. Okay? Like there's a difference. This is going to support you nutritionally, support you with the side effects. It's not going to wake up the adrenals. All right. It is fantastic if you're taking prednisone and you need support. Basically, everybody does. Unless you're super good at eating calcium containing foods, you need to be taking something like this. At the very least, everybody on prednisone is supposed to be taking calcium and vitamin D. That's what the American College of Rheumatology, their guidelines say. You should be taking calcium and vitamin D. But they don't include vitamin K2 and K7, which is going to keep that calcium from depositing on your arteries and hardening them, is going to help that calcium go to your bones. And those are just 3 of the 17 ingredients in here. They're all designed specifically to support you while taking prednisone. And you can get this at nutrinize.com or on my website. Here we go. Let me show you where you can get that. Here we go. Here we go. That's where you can find it. Ignore that phone call I'm getting. Okay, so you can find Nutrinizone to support you while you're taking prednisone. It's exactly what you need. So let's get back to his question. He said, which supplements help adrenals wake up? Like I said, none of them. He can't buy that pre-made supplement, but what helps? B complex, vitamin C, any help is appreciated. So let's talk about B complex first. So Nutrinizone does include B vitamins. It includes the best kinds of them. For example, methylated folate, the L7 methyl tetrahydrofolate is in here. And so, yes, folate and B3 and B1, all of those B vitamins are really going to help support your body while on prednisone. You need it to help you cope with the side effects. Then he says vitamin C. Vitamin C is in here too. There's evidence showing that your body is excreting vitamin C faster than normal while taking prednisone. That when they supplemented vitamin C to people who are on injected prednisone, which is called either Madral or another kind, they did better in the ICU in the hospital if they had vitamin C along with the steroid. So you need vitamin C while you're on prednisone. And then he said, any help is appreciated. Yeah. So those are great. Like if you can't afford anything else, get yourself some calcium and vitamin D and a B complex and some vitamin C. That's going to be a lot of pills. And by the time you bought all that, you've almost paid for this itself because this is 2 bottles. It's an entire month's supply. Like whatever. Okay. He says, what else helps to awaken up adrenals? So these are great questions and let's talk about those. Okay, so what else helps to awaken adrenals? And he says exercise. That's tough for me because of the breathing issues, but right now that's doing better. I can take walks. Certain types of exercise are better. Does that help waking them up, or is it worse to exercise when having suppressed adrenals? Does that lower the blood sugars too much, or is it good? So let's talk about exercise, prednisone withdrawal, adrenals. Let's talk about the whole thing. So if you are in true prednisone withdrawal and you're having muscle aches and pains, exercise is going to be an almost pointless endeavor because you're going to be in so much agony. Um, so it's not going to help. Like it's not going to push you through. It's not going to uh, solve the adrenal withdrawal problem. Exercise is a great thing to do while on prednisone, but it's not going to wake up the adrenals or get you out of withdrawal. Like exercise, I recommend is as like a great thing for everyone on prednisone, but it's not going to accomplish the goal he wants it to accomplish. It is not going to wake up the adrenals. Okay. And then let's talk about the blood sugars he's talking about. Because when you're in withdrawal, the blood sugar can be kind of weird. Like when you are taking high dose prednisone, your blood sugars are super high. But when you are in withdrawals, sometimes you can get low blood sugar. And so I wouldn't assume that exercise would cause blood sugar issues. If you're in withdrawal, it just might make your agony worse. Okay, then he says certain foods to awaken up adrenals. I'm not aware of any foods that awaken adrenals. Does sleep help? Do naps, or do they only suppress things more? Um, as far as your adrenal system and sleep, keeping a steady sleep rhythm, going to bed at the same time, waking up at the same time, is really helpful to support recovery of your adrenal system because that's part of how the adrenals recover is by knowing when is wake up time, when is sleep time, having a circadian rhythm that mirrors the sun, for example, waking up when the sun comes up, going to bed when the sun goes down, right? Like that rhythm that humans have been doing forever is really important to support your adrenals if you can. Um, if naps are making it so you're not able to fall asleep at night, and so now you're staying up all night and then you're taking a nap during the day, like you got to listen to your body and do what you've got to do. If you're truly in withdrawals, you're probably exhausted and need a nap, but is it keeping you from sleeping at night? So like you got to find that balance for you. Um, hey, okay, awesome. We have a few people. Hi from Jamaica and Heather. Other questions, drop them below. I'm going to just keep answering this Prednisone Warriors list of questions about rec- recovering the adrenals. Okay, he says, oh, let's answer her question. Ohio Beverly says, is it accurate that you can taper from long-term high-dose prednisone quicker on rituximab infusions? So tapering has several things we have to keep in balance. So when it comes to tapering, there's basically the two things we're looking at. We're looking at your disease being under control, and then we're looking at preventing withdrawal symptoms. So far in this conversation, this whole video, I've been talking about withdrawal symptoms, preventing withdrawals, helping us deal with withdrawals. But if you're talking about tapering long-term high-dose prednisone because you're keeping your disease under control, then the answer is yes. Getting on an alternative to prednisone, a biologic like rituximab, that's what I personally did. That's what got me off of prednisone, or Humira, or going on another pill like methotrexate. These alternatives to prednisone to help your disease get under control are a great strategy. Like I personally believe, and I have Harvard professors who agree with me, and the guidelines agree, that pretty much every drug is safer than prednisone. Like prednisone is the worst drug you can be on as far as safety goes. And so going on a drug like rituximab or methotrexate or Humira to get on lower doses of prednisone is fantastic. Like do it. All of those drugs are a better option than prednisone. Like people are scared of them like it's an injection or it has the letter X in the middle of it or it's been used for cancer. No, prednisone's also been used for cancer. Prednisone causes more side effects than any other drug. Like Do whatever you can to minimize the dose of prednisone to get you on the lowest effective dose of prednisone. Don't go into withdrawals. That's the other conversation we've been having. But if you can go on rituximab, that's fantastic. Like that is how I got off prednisone. That was what solved the problem for me. Was rituximab, also known as Rituxan. Um, it had side effects too. Like I'll tell you my quick experience of taking Rituxan because I'm guessing that's something you might be interested in. When I was taking prednisone, I took it for a disease called ITP, where my body was attacking my blood cells called platelets that are responsible for clotting. And so I was going to bleed to death over and over and over again. Like every time I tapered prednisone, my disease would flare, right? And so I'd have to go up higher dose, higher dose, higher dose. And it was a miserable journey. It was so awful. And so then the doctor's like, "Hey, we can either take out your spleen, which might be causing these attacks on your platelets, or we can give you chemotherapy or immunotherapy in the form of rituximab." I was like, "Sweet. Let's try that one. I don't want to go under the knife. I don't want to donate an organ. I want to just keep my body intact and let's try this chemo thing." As a pharmacist, I knew that this drug can come with side effects and that a lot of people have allergic reactions to rituximab, like have infusion reactions that it can cause in very, very, very rare cases, fatal reactions. So I was worried about that. So I called my friend who's an infusion pharmacist who works in the transplant part of the biggest hospital in my state. Like, he's, like, the number one guy I could possibly call in my state. And I was like, "Is this real? Like, is this just an artifact that's in the medical literature? I'm worried about it. What should I do?" And he said, "I've never seen it in my 15 years practicing pharmacy in the hospital. It is definitely a possible reaction that somebody could have, but if you were to have an infusion reaction, an allergic reaction to the rituximab, you're in the hospital for this infusion, they can take care of that reaction. They can support you. You're not going to die." I'm like, "Okay, sweet." And so I went in, had my first infusion. They gave me Benadryl and Tylenol to hopefully suppress any infusion reaction I might have. But guess what? I still had an infusion reaction. My palate up here got all tingly, kind of the back of my throat got all tingly, and that's like a symptom of an infusion reaction. And so in that case, the nurses slowed down the infusion. Instead of having it go fast, they slowed it down. They gave me more Benadryl and Tylenol and waited 30 minutes and it went away. And so they slowly increased the dose back up and I was able to tolerate it and they were able to manage the infusion reaction and it all went well. And I repeated that I did it a total of 4 times. And uh, by the end, I knew it was working for me, but I didn't know if it was going to last long term. And I'm happy to say 7 years later, it's still put me in remission. So rituximab is fantastic for me personally. Um, and I've also never personally heard of anyone who's had a terrible reaction to rituximab, even among my other pharmacist friends. So, what other questions do you have about that? If you have more, other than that, I will go back to answering these questions about recovering adrenals, prednisone withdrawal that came in. So, the next question is, what about salt? High or low salt better if you're dealing with prednisone withdrawal? Now, this is really tricky because normally if you're taking prednisone, you're on high doses, salt is not a good idea. Like high salt is a bad idea because prednisone is already jacking up the salt in your body, which is making you hold on to fluids and suppressing your potassium, and your whole fluid balance is being thrown off. You're gaining water weight, you're peeing all the time. Like it's just this whole mess. And so you want to just keep a healthy salt intake when you're on normal doses of prednisone and you're not dealing with withdrawal. So that's my general advice for most people taking prednisone. Definitely talk to your doctor if you've got kidney issues or other things going on. But for general people, you want to limit salt when you're taking prednisone. But when you're in withdrawal, if you were here earlier and you saw me going through the symptoms of withdrawal, hyponatremia is the medical term for low sodium in your blood. So at that point, should you be replenishing that? That's a tricky question. And so it's really something you have to talk to your doctor about. Like, are you actually having low sodium? Is withdrawal actually causing low sodium for you or not? And that's not a question I can answer in a live video. Like, that is really specific to your blood test. Is it safe or not? Like, it's not something I can really answer. So, generally, for people taking prednisone, we're not talking about withdrawal again. I don't recommend doing electrolyte supplements because they're usually really high in sodium, and that's going to worsen the whole electrolyte imbalance you're already dealing with. So it's just that's a really tricky, nuanced question that is really important. Okay, Ohio Beverly says I start mine. I believe she's referring back to the rituximab. November 10th for 4 weeks. Did you have fatigue or issues in the days following your infusions? It is so good to hear your journey. Thanks for sharing. It makes me feel less stressed. Yes. I'm glad I guessed right that this was a potential thing in your future. November 10th. That's great. And yeah, it was 4 weeks for me. I did have fatigue. And actually, what's really interesting is at the time I was back up on high dose of prednisone because the day that they were supposed to start my infusions, they tested my blood and it came back that a number that's supposed to be between 154 to 400 in a healthy person, mine was 27. It was super duper low. It was so low that they're like, you've got to start this. I was actually like, when they pricked my blood to find out how low it was, I tried to stop the bleeding and I couldn't stop the bleeding. It was dripping on the floor in the hospital bathroom. Like, it was so bad. My disease was so bad at the time. And so my disease was flaring. I was on high dose prednisone and I was on this rituximab immunotherapy chemotherapy medication. I was not well. And so was the fatigue from my disease? It causes fatigue. Was it from prednisone? It causes fatigue. Or was it the rituximab? Yes. All of the above are reasons I could be experiencing fatigue. The combination of these two were causing really bad insomnia. I was feeling awful. And I was at that point when I was feeling at my lowest. Like, I have done prednisone at that point for 7 months and it's not working. Like, it was so awful. Like, I have to go do chemotherapy. I'm in my 30s. Why am I so sick? Like, why am I like almost dying? And now I can't even sleep and I'm cranky around my kids. Nobody wants to be around me. I was awful, okay? Like, it was an awful experience, and so I'm at this lowest point, and I'm trying to take a nap with my toddler. Lie down on my bed, I'm like, "I'm just gonna take a nap, like, it's gonna be fine. I'm gonna take a nap, I'm gonna be fine. I'm gonna be fine, I'm gonna be able to sleep. I'm gonna actually get some sleep now." And I'm sitting there staring at the ceiling, like, mind is racing. "You're not sleeping. Like, you might be exhausted, too bad. You don't get to sleep right now." And I was like, "But but why?" And at that moment, it was like there was a light, that there was like a voice that spoke to me, and I was like, "What is happening?" And it said, "Megan, you need to create a supplement for people on prednisone." And I was like, "What?" Like, "Hi, I'm a pharmacist. I went to pharmacy school." We learned in pharmacy school that we do not like, supplements are, for the most part, worthless for people. Like, there's not a lot of evidence supporting it. Supplements are a thing. You might as well just be flushing dollars down the toilet for how well most supplements work. They're just snake oil. They're just taking advantage of people. They don't work. That was what I had been educated to believe in my pharmacy school career. At the same time, that textbook right there, that big fat black textbook and that pink and purple review book for my pharmacy school exam both said that people on prednisone actually need a supplement. They need to be taking calcium and vitamin D. I'm like, okay, so like Supplements are worthless, but supplements are not worthless for people on prednisone. But now I'm hearing this voice that's telling me you need to create a supplement for people on prednisone. I'm like, okay, but like I don't believe in supplements, so how what? Like I don't understand how that's going to work out. But then I did research and I figured out that prednisone not only steals calcium and vitamin D like that textbook says, like the College of Rheumatology, the doctors who prescribe prednisone the most say, I also discovered it's stealing those B vitamins, stealing vitamin C, it's stealing melatonin. That's why you can't sleep. That's why I couldn't sleep. Prednisone was stealing it. It's stealing all of these nutrients. And I was like, oh, wait, this is actually legitimate. This is actually evidence based. Like there's a very legitimate need for people on prednisone to be taking a supplement. It's not snake oil. It's not like just to sell something. It's like people actually need this. And I was like, okay, fine. I guess people actually need a supplement while on prednisone, but I didn't want to do it. I was a busy young mom, pharmacist. I had a job. I didn't need it. I didn't need this. But I did. I did it anyway. I listened to the voice. I overcame that resistance. And that was when I created Neutronized Zone. And how do I share this? Okay. I created Neutronized Zone. It's the first and only supplement for people on prednisone. I spent a year developing this, going through the research, figuring out the very best ingredients to make sure that it was safe with prednisone, with other drugs that people take prednisone alongside it, like methotrexate and things like that, that there were no drug interactions with those medications, that it was safe for the conditions people take prednisone for. I made sure that the ingredients were the best quality, they came from the best sources. And then I spent forever finding the right manufacturer. The whole process took a year from the idea moment when I was on rituximab and prednisone and suffering awful fatigue, like you said, until I had a product to sell. And it's been on the market for 7 years and people love it. It helps people feel better. It's exactly what you need. You just take 2 in the morning and 2 at bedtime, and you feel so much better while on prednisone. You won't feel that awful, miserable fatigue, those awful side effects that I did. I secretly created this because I knew if I'm the kind of person with this autoimmune disease that waxes and wanes, it might flare someday. I might be on prednisone again. Sure enough, I've been on prednisone again. And guess what? I've had this for myself. So I personally take this every day, even though I'm not taking prednisone or any other steroid right now. It's still a fantastic supplement. The morning bottle not only helps with the bones, which I have a family history of osteoporosis, but it also helps with your metabolism. There's ingredients in there that help support healthy weight, healthy metabolism, healthy blood sugars, healthy blood pressure, healthy cholesterol, and it helps me feel my best. And then the bedtime bottle has melatonin and magnesium, helps you feel calm, helps you get restful sleep at night, which I wish I'd had when I was taking prednisone. Like that was the worst thing for me. It was the loss of sleep and making me so cranky. And so you just go to nutrinize.com or you can go to Amazon, either way. And this is exactly what you need to help you feel your best while on prednisone. So, I'm not going to say it's going to kick your adrenals back into gear, which is how we started out this video. It is going to help you feel your best while on prednisone. It's you can know you're giving back the nutrients that the doctors recommend that you be supplementing. It's going to help you counteract the side effects that are caused by nutrient depletion. That this is legitimate. I have over 100 scientific articles showing that prednisone is depleting calcium, magnesium, chromium, vitamin D, and so many more nutrients. And they're given back in the exact doses that you need. And it's like you don't have to take anything else. This is everything you need while on prednisone. Just take 2 in the morning and 2 at bedtime. You just take your morning pill of prednisone with your 2 morning capsules, and you're set. It is everything you need. So I'm thrilled that this is available. It was what I wanted. Like, I Googled prednisone vitamin and, like, nothing showed up. Nobody else created it. So I was like, "Fine. If nobody else is gonna create it, I'll create it." And so I did. And reluctantly, it's here and it has helped thousands of people. So if you're like, does it work? Thousands of people have found success. You can go on Amazon or nutrinize.com to see those reviews. It's helped people with tapering. It's helped people with their weight. It's helped people with moon face. It's helped people with sleep. It's helped people with their cranky, miserable moods. One guy was like, my wife was saying that you are not yourself. Like, I don't know who you are right now, but prednisone has turned you into a monster. And then he started taking this and he's like, I'm back to my cuddly self. And this is like a 55-year-old guy. I don't know if anybody's calling him a cuddly self aside from his wife, but still, like, it brought him back to being himself. His mood was back to being himself. People have said their appearance, they look like themselves again. You feel like yourself again. It's exactly what you need. And then I recently upgraded, so it's in this pretty box. I'm so excited to share it. So this box, look how pretty it is. Ooh, look at that. You get Nutrinize, Zone, and like my promise is that you'll feel like yourself again. I don't know if you can read that. You'll feel like yourself again while taking prednisone if you take Nutrinize along with it. It's exactly what you need. And this, I love this box because Amazon was breaking apart this little plastic shrink wrap seal. And so now I can just ship it right here. And it's a whole month supply. It comes as 1 month right here in the box. It's perfect. So, and you just take it along with your daily dose of prednisone and you feel like yourself again. And so that was my secret unveiling. I haven't actually shown that on camera until this moment. So if you saw that, now you have the secret. And if you buy prednisone support Nutrinize on Amazon or my website, then there's a special QR code I'm going to flash for just a second right there. It comes with a, did you see that? Free gift. If you scan that QR code, you'll get a free gift. And you don't know what that free gift is yet, but I will give you a little sneak peek. If you're struggling with tapering, I have a free gift to help you there. If you're struggling with weight, I have a free gift to help you there. If you're struggling with sleep, I have a free gift to help you there, and so much more. There's at least 5 special gifts that you get when you buy Nutrinize and claim that free gift by scanning that QR code. Okay, we have a few questions. Peter says, I'm getting down 5.5 with my steroids, getting aches and pains. Is this normal? What? You are so awesome, Peter. That's exactly where we've been talking. Feel quite tired and down, been on steroids for years plus now. This trying to work in my workshop, making custom drums, never had pain when I go to sleep. That's so cool. You make custom drums. Very cool. So if you want to watch from the beginning, we're 42 minutes into this. I have been covering this topic in depth, but I'm going to cover it again because it's still a question that everybody seems to have. It's just so common. You're down, you've been tapering down, and now you're having aches and pains. Is this normal? Yes, it is normal. You feel quite tired. Yes, that's normal too. Do you need to live this way? No, you do not. What you're experiencing is likely prednisone withdrawal. Prednisone withdrawal is something that is I didn't know about until I became the prednisone pharmacist, but it is real. It's just like if somebody suddenly goes cold turkey off of alcohol, they're going to go into withdrawals. They might even have seizures. They're going to have to be hospitalized. It's a real thing. It's real with prednisone and the aches, pains, fatigue, feeling tired. It's a common reaction. And so what do? You need to go back up a dose until you can not be suffering this anymore. It's unfortunate, but as far as I know, that's the only way to deal with the aches and pains and tiredness is to go back up to the lowest dose where you weren't feeling that. So if you're at 5.5, were you feeling that way at 6? If you weren't feeling that way at 6, go back up to 6 and then wait a while before you try tapering down again. Okay. But definitely talk to your doctor because I am not your doctor. Okay, Janet says, hi from South Carolina. I've been taking prednisone since June. I'm going through a taper now. So far from 20 to 15. I'm also taking methotrexate and folic acid. Any idea how long before I will be off? So, um, I kind of covered this earlier, but let's talk about this because when we talk about tapering, there's two things we're looking for. There's prednisone withdrawal, which I just covered from Peter, and then there's your disease going under into remission or into control. Okay. So there's the disease and there's the withdrawal. We've got to keep them in balance. So if you're taking methotrexate and folic acid, I'm guessing the purpose of that is to help bring you down safely on your prednisone while the methotrexate slowly kicks in for your disease. Peter says, I've never been pain free. Oh, I'm sorry, you've never been pain free. Oh, but okay, back to Janet. So, um, I don't know what you're taking prednisone for. Oh, actually, you answered it. My autoimmune disease is inflammatory arthritis, systemic sclerosis, and PMR. Okay, well, that helps me answer. I'm gonna just focus on the PMR because those other diseases are hard to give a more definitive answer because yeah, it's harder. PMR is a more clear answer that I can give you. So if you are dropping from 20 to 15 and the methotrexate's kicking in, hopefully it's helping. If it's not, it's hard to know for 3 to 6 months. You really need to stay on it that long to find out if it's really helping. If it is helping, then you can slowly taper off of prednisone over time. But it really depends on whether disease is flaring, whether your PMR pain is coming back or not. And a lot of people can drop from 20 to 15, no problem with PMR. You can even drop from 15 to 12 and a half, 12 and a half to 10. And most people with PMR are still okay. But it's dropping below 10 milligrams is where it really gets tricky when it comes to prednisone and PMR. And I've made a ton of videos about that. In fact, just this week, I made a whole video series all about PMR. Check it out if you haven't already. And so it really depends on whether your disease is under control and whether or not you're having withdrawal pain. So that's tricky. But PMR in general, people take prednisone for 2 years. That is the average person who has PMR will end up taking prednisone for 2 years. Hopefully that helps. And you've been on methotrexate for 7 weeks. Thank you for that. That helps me answer a little better. Yeah, methotrexate maybe has started to help, but probably won't fully kick in for like 3 to 6 months. So it's really hard to know if it's going to help. And then as far as I don't know how effective methotrexate is for arthritis or systemic sclerosis, but for PMR, it works in some people and it doesn't work in other people. So it may not be the best other medication to add on, but it might be the best when we're considering the other diseases as a whole. Other medications that have been shown to be better include Kevzara and Actemra for people with PMR. So those are something you could try if methotrexate doesn't work out. Okay. All right. Thanks everyone for joining me today. This live stream was sponsored by Nutrinize Zone. You can get it at nutrinize.com or on Amazon. Just click this QR code or the link, and it's exactly what you need while taking prednisone. I created it myself using my doctor of pharmacy board certified expertise and my experience as a patient. So it's exactly what you need while taking prednisone. Go to nutrinize.com today to get the support you need. Signing off is Dr. Megan, your prednisone pharmacist.